There's lots of great ways to manage your health at home, even when you're not in the doctor's office. First thing you can focus on is your diet. Avoiding salt as much as possible, and salt is usually found in a lot of canned foods as well as processed fruit foods, and that includes frozen dinners. Also, you can check your nutrition labels and look for the salt content or the sodium content on there. That can be very helpful in deciding which foods to choose and which ones to avoid. Making sure you're eating your fruits and vegetables, and again, choosing those fresh and frozen fruits and vegetables as opposed to the canned ones is really, really good. Avoiding those cup of fruits too. So people often will eat like cup of peaches and things of that nature, and you want to avoid those because it has way too much sugar in them. Next would be like choosing fresh deli meat as opposed to those prepackaged meats. The amount of salt is much lower in your fresh deli meat versus the prepackaged ones. Next would be choosing baked fish as well as turkey, your white meats, and trying to avoid the red meats like your beef and pork. Also, you can avoid carbohydrates, so choosing your whole wheat versus the white breads and pastas is a really good choice. Also, obviously avoiding too many sweets like cookies, muffins, and donuts. I never tell patients that they can never do it, but just making sure you're monitoring closely how often you're doing it. And then the next component would be exercise. Trying to exercise 4 to 5 times a week is good, and oftentimes about 30 minutes each day. You can either walk or you can swim or even go to the gym and just work out and lift weights and things of that nature. When you're walking, you want to make sure you're going at appropriate pace. I often see people at the recreation center or the gymnasium walking so slow that they're able to laugh and talk with their friends. Typically, if you are walking at a pace where it's difficult to have a conversation, that's going to be your best pace to get the best workout. Strength training is a good option as well to avoid osteoporosis, especially for our older women. And the amount of weight doesn't have to be super strenuous. It can be lightweight. Just building those muscles around your bones is going to be helpful. And then lastly, taking the stairs instead of the elevators. If you can and you're able, choosing the stairs, even if it's just for a couple of flights, will definitely be helpful to keep you active. Some things to avoid, for our smokers, it's never too late to quit smoking and decrease the amount of smoking that you're doing. And then lastly, just making sure you're not stopping medication before talking to your doctor. This is a conversation that should be had with your doctor. Oftentimes, patients will run out of medication. Instead of refilling it or continuing to take it, they'll just stop it and think that that's okay. But you really want to have a conversation with your doctor before you do those things. Knowing your numbers is really, really important. Oftentimes in the office, I'll quiz my patients and give them little pop quizzes like, for instance, what's your hemoglobin A1C? And so for those of us who don't know what that is, it basically tells us how your blood sugar is doing for the past 3 months. So when you take a little finger stick, it usually tells about how your blood sugar is doing for the past 5 to 15 minutes, but your hemoglobin A1C will tell us how you've been doing even when you're outside of the office. And those numbers should change over time, and there's certain goals that we have for various patients. So knowing that number is really, really good. Another number that's really important to know is your blood pressure. This is a really good indication of your heart health. I don't ask patients to necessarily memorize or remember what number's on top and what number's on the bottom, but I think it's good if you are aware of if your blood pressure is high, if your blood pressure runs low, or if you have a good blood pressure. So just those three, either high, low, or good, is often really good for patients to be aware of. Lastly, it's really important to know, your cholesterol, and that's another indication of how your heart health is doing as well. And again, this is a number that I don't always make my patients know the exact numbers that they are because it can be a little complicated, but knowing if you have high cholesterol, low cholesterol, or good cholesterol. And when you have high cholesterol, you get worried, or at least physicians, we get worried that it could indicate patients having a higher risk of stroke or even heart attack. And those are things to really look out for. Having a medication routine is very, very important. I tell my patients to try to have an up-to-date list of all their medications and have it easily accessible, not only for the patient, but oftentimes for the loved one that usually takes the patient or goes with the patient to their various appointments. It can be really helpful for doctors as well as new nurses that the patient might come encounter with to know what their medications are, because if you're taking more than 3 medications like most patients are, remembering the doses and the names of those medications can be really, really challenging. So having that up-to-date list and having it readily available is really, really helpful. Secondly, having a pill container. A lot of times people will have pill containers that have AM section as well as a PM section, so they can have their AM meds with their PM meds. And that pill container, filling that every week at the same time can really, really be helpful in making sure that patients remember if they've taken all their meds and what meds they may or may not have missed if they have, because it's right there in one central location. Next would be alarms. This is a tactic that I sometimes tell patients to do if they're really having a lot of difficulty despite having pill containers and things of that nature. Setting an alarm in the morning that goes off every single morning at the same exact time, and when that alarm goes off, it's time to take your meds, and then as well as in the evening having an alarm for that time as well. And last but most certainly not least, your placement of your medications. Oftentimes we put our medications off in a medicine cabinet, which can be out of sight, but sometimes if you have your medications in a location where it's easily accessible, like next to your toothbrush or next to the coffee machine, you'll know when it's time to either brush your teeth or drink your coffee or make your coffee, it's time to take that particular medication. So just placement in that regard can sometimes be helpful for patients to remember to take their medications as they should. So medications are very important in that regard. Telehealth is a very, very safe option. It's definitely more readily available since COVID-19 has outbroke. Oftentimes patients, especially older patients that are not quite as technologically savvy, are nervous and or have difficulty utilizing this option for their care. But there's a lot of different resources. You can ask a loved one or a friend to help you with setting up the computer or the phone for the telehealth visit. Also, there's plenty of staff available that is there to help before your visit even occurs, to make sure that you're ready and you're aware of all the things to either press or do in order to actually have the telehealth visit. So very safe option, very readily available, and not very challenging to use if you ask for the help necessary. And then also, there's certain instances where a telehealth visit might not be the best option for the patient to use, but rest assured that physicians are there and they know if the visit needs to be something that's done in person, they'll be the ones to let you know, hey, you need to come in for this particular visit, or the next visit, I want to see you inside the office versus a telehealth visit. So that way there's no question of if your visit is appropriate for being telehealth or in person. There's lots of things to be considered as patients age. First and foremost, obviously I'm biased because I am a primary care provider, but make sure you have a primary care doctor, and you need to see them. And I would say at least twice a year if you're over the age of 50, and sometimes even more often. That should be up to your physician or your provider, but definitely having a primary care provider is first and foremost. Next, I would say definitely making sure you're up to date on your vaccines, getting your yearly flu shot, getting your shingles vaccine, as well as your pneumonia shots. Those are things that your primary care provider will definitely let you know when it's due and when you should be getting them. Next would be screenings. Colonoscopy is something that comes when you get older, is definitely needed. Mammograms, making sure you're up to date on your mammograms, and pap smears, so definitely making sure you're up to date on your screenings is super important. Also making sure after retirement you start new routines, and it's a great opportunity for new hobbies to stay active. So those things are really important, especially after you get to the retirement age. Another component as you age is you have to remember, your diet and your exercise routine is going to be drastically different at 55 than it was at 25, and it should be. You're an older individual in your 50s, and you can't keep doing the things that you were doing when you were in your 20s. Your body's different, time is different, so just keeping those things in mind is really important. I like to touch base on advanced directives as well, and what that means is just basically having your wishes in writing of what you want and don't want as it pertains to your health. Sometimes unfortunate situations happen where we can't make our own decisions anymore because of certain health conditions, and making sure your family is aware of what you want and how you want things to be done if you're not able to make those decisions. And I will say that oftentimes a conversation is not enough, so having that in writing is really, really important, and talk to your primary care provider about that. And then lastly, now that COVID is going on, and we know that COVID risks are even can sometimes be considered higher for older adults, make sure you're wearing your mask. It's really, really helpful and very important, especially as you get older. So wear your mask, please.